So let me talk about M2F top surgery. In M2F top surgery, basically we have to feminize the top of an individual who is under transition. And for that, even after starting the hormone treatment, some of the individuals develop the breast bud and they may not require to undergo any surgical transition. Those who require surgical transition may undergo M2F top surgery either by putting an implant or by undergoing a fat transfer. In a fat transfer, we do a fat collection from outer hip area, abdomen area or an inner thigh area. We process the fat and then we inject the fat in a multiple layers, that is below the gland, inside the gland, below the skin and inside the pectoralis major muscle. And by doing that, we give a good mold or a good mount of the breast. But the problem with that is fat absorption. There are high chances that 30 to 35% of the fat will get absorbed, which is a part and parcel of this process. Because whenever we inject the fat, that fat cell will look for the blood vessel. If they get the blood vessel, they survive. If they don't get the blood vessel, the body will try to eat away and clear them from that field. That is the cons of fat transfer. In a breast implant, silicone implant, whatever volume of implant we put inside the body, that stays like that in most of the patients. Very few people undergo silicone leak or a capsule formation and other type of complication related to implant. So to summarize, to do M2F top surgery, we have only hormone treatment, we have fat transfer and we have implant insertion. In an implant insertion, we normally put the implant below the pec major muscle because most of the individuals, they don't have a good amount of skin fold thickness or a breast gland developed, and which can lead to implant visibility if we put the implant below the gland. So there is one important aspect which you can see in my video, that we dissect the pec major muscle and the upper end of an implant stays below the muscle. However, the lower end of an implant is below the gland. Now, let me just summarize everything. That what is the good part about fat transfer is it is an autologous tissue, your own body tissue going somewhere else. So the chances of rejection or severe reactions are very much less. The problem, the outcome is guided. The good part about silicone implant, which is this kind of implant, is they have a particular dimensions and a projection which stays inside the body for longer period of time. But the bad part is, since it's a foreign material, the body can create a capsule around that particular implant and which can create some problem. And however, this complication we see in 5 to 10% of the patients, not all. Thank you very much.